Next one, basal cell carcinoma. So we already said basal cell carcinoma occurs in basal layer of the skin. We can move on to the detail about the basal cell carcinoma. So malignancy of the basal keratinocytes of the epidermis, and the main causes is ultraviolet radiation and the fair skinned individuals. We can see later about the etiology. So basal cell carcinoma simply means it is the malignancy of basal keratinocytes. And the basal cell carcinoma is the common skin cancer, and most of the time it may be benign, rarely it metastasis. And it will have the different types and different appearance. So this we can see easily identify the skin cancer because of the varying shape, size and color change. Then most common on the head and neck, followed by the trunk, then the extremity. So most commonly these lesions may be occur in the head, neck, trunk and the extremities. And it can be easily identified by the biopsy. And non-healing scars also have to undergo the in order to identify the in order to identify the carcinoma, the non-healing ulcers have to be have to do biopsy. Okay. Non-healing ulcer may increase risk for skin cancers. In the previous slides, we have seen one or two etiology of the uh, basal cell carcinoma. So mostly the etiology is the ultraviolet radiation. So the frequent sun exposure may leads to the skin cancer. Then X-ray exposure, chemicals like arsenic exposure, then immunosuppressive stage with any medicines, okay, or due to any comorbidities. Then syndromes like xeroderma pigmentosum. So xeroderma already I explained. It's a extremely dry skin. So due to the inability to repair UV-induced DNA damage and nevoid of BCC syndrome are characterized by multiple basal cell carcinoma occurring in early stage. So when the due to the inability, okay, when the sun rays or UV rays is exposed to our body, there may be chance for the DNA mutations. So if mutated, if our body is what to say, yeah, if the body has active immunity, the body can overcome the DNA damage, but sometimes it is not possible. So if gene mutation is occurs, it may leads to a cancerous lesions. So actually the basal cell carcinoma symptoms will be the new skin lesions. The skin lesions will be suddenly occurs. Then the lesions have itching, feature of itching. Then next characteristic is easy bleeding when shaving or abrasion. Okay, so that is the important feature, easy bleeding tendency. The next one, non-healing lesions. Okay, if any injuries occurs to the lesions, it is not healed. So again, a risk of cancer. Then after that, these lesions will be changing its shape, color. Okay, so varying shape and color may occur. So that is the main symptoms of basal cell carcinoma. So here you can see a pink translucent pearly bumps which might have blue, brown or black areas. So you can see a what to say a bumps or a lump, what to say, a nodule like appearance in the face of the patient, right? So after some time there is a growth. Okay, pink growth with raised edges can be seen, especially in the center. And there is the presence of abnormal blood vessels, and it is increased chance to spread. Then again, it changes to pale or yellow areas similar to the scar, and this nodule it is changed to become a pale or yellow color and look like a scar. After that, it raised reddish patches. Raised reddish patches you can see. Okay, then it is open sores which may oozing or crusted areas, but that does not heal. So in the at last there will be a non-healing ulcer. It will not be healed. Okay, so that indicates the patient developed cancer. Regarding the prevention of basal cell carcinoma, first one, avoid the midday sun. So we knew that the presence of UV rays will be increased in the midday sun. So it is better to avoid this midday sun. Then next one, wear sunscreen with high SPF as much as possible. So it is better to use sunscreen lotions. So it will skin protective effect. So this will be effective for the patient, those who are exposed to a long time sun exposure. Next one, cover up. When possible, put a long sleeved shirt and wide brimmed hat. So this cover up that will helps the body to protect the uh, sunlight. Okay, so if you cover the body or if you are using a hat, so that area there will not be a direct sun exposure, so it will help us to prevent skin cancer. Then avoid tanning beds, that I already explained. Those who are light colored skin or the fair skin people, in order to darken their skin, they will use the tanning beds. Okay, so it should be avoided. As a diagnostic measure, we can do the biopsy and the characteristics of the skin can be identified. The history had to be taken. Okay, see, these all are the general measures to do the diagnosis. Then on treatment, regarding the treatment, first one, simply electrodesiccation and the curettage. So excision, it is the better choice for the basal cell carcinoma. Then if it is enlarged, it is not a good options. Okay, so if it extend to the other layer of the skin or localized spreading is there into the deep layers, the dissection and curettage will not be helpful. And some lesions can be do the shave removal. Okay, 3 to 4 millimeter clinical margins can be removed.